Hi, I'm Donaldson, and I'm going to be talking about psychotropic drugs, specifically the pro-drug compound psilocybin. So psilocybin is a pro-drug that is found naturally in over 200 mushroom species, and when it is ingested, it's broken down into the active drug psilocin, which inhibits the reuptake of serotonin. Also, it acts as a neurotransmitter similar to the structure of serotonin, so it can also bind with serotonin receptors in the brain, and this is what causes hallucinations. There is also changes in brain activity in the hippocampus, the anterior cingulate cortex, and in the amygdala. Today, psilocybin is understudied and negatively portrayed by the media. DrugAbuse.gov lists its symptoms as nervousness, paranoia, and panicked reactions. Quote, psilocybin could lead to unintentional, potentially fatal poisoning, unquote. The Inquirer speaks about psilocybin in such a way, but it also lacks information. It negatively portrays them by saying, quote, there could be permanent damage to the nervous system we might not be aware of, unquote. The NY Times does a better job by acknowledging the research that has been done in the past, but still continues to portray it negatively, saying that there is no current research that supports the use of it. While all three of these sources are correct in saying that not enough research has been done on psilocybin, all three of them also make accusations and statements about the drug that have no basis in scientific research. First, we are going to look at the positive attitudes and behavioral changes that Griffiths et al. In 2016 researched. Quote, psilocybin occasioned mystical-type experience in combination with meditation and other spiritual practices produces enduring positive changes in physiological functioning and in trait measures of pro-social attitudes and behaviors, unquote. This experiment was done by using 3 experimental groups of 25. The first group was given a small dosage of psilocybin, the second group was given a larger dosage of psilocybin, and the third group was given that same larger dosage of psilocybin, as well as increased spiritual rapport. The observers checked up on their participants 6 months later and conducted studies of positive attitudes and behaviors. One study that they looked at was observer-related behavior. The low dose scored about a 75% increase, while the higher doses scored 87% and 89%. Next was the community observed behavioral test. The lowest dose scored about a 3.5% increase, while the high dose scored significantly higher at about a 9% increase. Here we see the varying methods observers use to quantify lifestyle changes of participants. What's important to look at here is that the stars mean that there have been significant increases, and we see out of all 12 of these tests that there have been significant increases between the high dose and the low support dose. Some of the more important studies to look at here is the altruistic and positive social effects, the well-being and life satisfaction, and the positive mood, all which had great increases through the high dose, high support try. Next, we're going to be looking at decreased amygdala hyperactivity, which then leads to increases in mood under the drug psilocybin. Cray and Mann et al. In 2015 looked at the effects of small doses of psilocybin under 25 participants, all about 24 years old, and looked at how it affected the responses to negative and neutral stimuli. The findings suggested that there was less emotional effect from negative stimuli of the participants that took the psilocybin than the ones that received the placebo. In the bottom left, we can see the brain activity of 2 participants, one that took the placebo and the one that took the psilocybin. We can see that it affects the primary motor cortex activation on the right under the participant that took the psilocybin, and that there are also stronger effects in the right amygdala than the left. Under the influence of the drug, there was a great increase in mood, but it did not also increase anxiety, showing that there were no adverse effects among the patients. There are many possibilities now to stabilize hyperactivity in limbic areas, which can then lead patients with severe depressive mood disorder to seek treatment. Next, we're going to be looking at the clinical safety and possible uses for depression treatment of psilocybin. There are emerging possibilities of psilocybin as a therapeutic drug and in helping to treat severe depression and helping to cope with end-of-life anxiety. The Garhart-Harris et al. In 2016 hoped to serve as a precursor to psilocybin research to come. The findings of this were mostly to support the continued research of studying these types of drugs because of their observed safety. However, even in the participants, there were sustained improvements of their anxiety and anhedonia. This study followed 12 patients, all with moderate to severe treatment-resistant depression. They received 2 doses, 7 days apart. Quote, psilocybin was well tolerated by patients, and no serious or unexpected adverse events occurred. The non-serious and unexpected events that occurred were nausea and headaches. Depressive symptoms were totally reduced within a week, and sustained improvements continued even with anxiety. Quote, this study provides preliminary support for the safety and efficacy of psilocybin for treatment-resistant depression and motivates further trials with more rigorous designs to better examine the therapeutic potential of this approach. Now we're going to look at actual possible treatments for alcohol dependency using psilocybin. Bogenschutz et al. In 2016 used his study to follow participants for 36 weeks and measured how often they drank. By the end of the 36 days, there was a significant decrease in the participants' percent of drinking days. During this time, they were also required to attend meetings to help cease their drinking habits. This helped to control for possible alternative reasons why there was a drop in reported drinking amounts, because the drug was not given to them until 4 weeks into the program. Quote, overall, the response of our alcohol-dependent participants to psilocybin was qualitatively similar to that of which had been reported in other samples. Unquote. In the Griffiths et al. Study in 2016 that we looked at earlier, it really helped to build the foundational standing points for the Bogenschutz et al. To apply what Griffiths had learned into Bogenschutz's study. This is a figure from the Bogenschutz study, and as we see on week 4, when the psilocybin was first introduced, there was a significant decrease in the participants' amounts of drinking days and heavy drinking days. Now we look at psilocybin being used to treat tobacco addiction. In a study done by Matthew W. Johnson et al. In 2014, he used 15-week smoking cessation treatment using psilocybin administered at the 5th, the 7th, and the 13th week. There were 15 participants, all of which had to smoke at least 10 cigarettes a day prior to coming into the treatment. Quote, our results show promise regarding the safety of psilocybin as an adjunct to smoking cessation treatment. Adverse effects associated with psilocybin consisted of modest acute increases in blood pressure, heart rate, dysphoric subjective effects. Unquote. After 3 sessions of taking psilocybin, these participants reported more positive views on life, themselves, and social situations, as well as a significant decrease in the number of cigarettes smoked by almost every participant. In conclusion, while psilocybin may still be in its infancy as a drug, all the studies emphasize the lack of adverse effects as a result of this drug, which totally refute the popular media claims shown at the beginning of this presentation. Overall, while some claims by the media talking about the unknown effects of psilocybin are valid, there is no research as suggested by these studies that show this drug having negative damage or negative long-term effects. These studies hopefully work toward using psilocybin to help treat depression, tobacco addiction, and alcohol addiction, as well as perhaps other mental illnesses. Thank you.